Welcome back. Dr. Dorothy, what exactly is travel health insurance?
Thank you. Travel health insurance is simply what the name is travel protection for unexpected health or medical incidences for international travel. So you have your domestic health insurance and you also have the travel. So the travel covers you outside your country of residence. It is across country borders. So you'll be looking at travel protection. Those are the key things to consider. You have the travel protection. You're talking about health, and you're also looking at the fact that it's for international travel. So in travel health insurance, our concern will be with those things that directly or indirectly affect your health when traveling. It could be associated directly with the travel, either due to change of environment or due to change of the weather. It could also be due to medical mishaps, like for people who already have pre-existing conditions. So they need to be careful, they need to worry, they need to ensure that there's no exacerbation or complication in that existing health condition. So it's all about protecting your health while you're outside your comfort zone, which is your home or your country of residence.
Thank you so much, Dr. Dorothy. Now, Dr. Adedoyin, what are the most common health risk factors associated with traveling?
Well, I would say that prior to traveling, you must be concerned about your health state. And then I'll look at the problems that can happen while you're already flying. And then the problems you may encounter when you have reached where you're going to. So just before traveling, you could have a health condition, pre-existing health condition, diabetic, hypertensive, etc. And therefore, those things may still be a problem. While flying, common conditions that could occur include things like vomiting, nausea, traveler's diarrhea, motion sickness, or even things that were not planned for before. People could have episodes of stroke in extreme cases while on board. And we are looking at traveling for hours, long distances. And then looking a bit at when you have arrived where you're going to. Where are you going to? The country you're visiting, what's the health problem there? And so that's the other part of it. Do they have malaria? Are you coming from a zone where there is no malaria and you're going to visit a place where there is malaria? Or the other way around, it could be some other strange illnesses to you. And so when you look at the problems with traveling, I'll look at those three aspects of travel.
Thank you very much. Dr. Dorothy, would you like to add anything to what she said?
She actually mentioned it all. It's about looking at yourself. What health conditions do you have? What could happen in the plane? And what could happen after you have arrived?
So why is travel health insurance necessary?
It is important, just like your health is important. Take away the travel is about health, So it's important, just like we're concerned about health, whether we're traveling or not, you should also be concerned about your health when you're outside your location. Now, the emphasis being put to travel insurance is because you're outside your comfort zone. You might have like a pre-existing health condition, as she says. You already have your physician treating you at home, who knows your medical history, who knows everything about you, and you're living there to travel. Should you have an episode, who do you talk to? So when you leave your comfort zone, you're taking care of your health. It's maintaining good health, just like you do when you're not traveling. The concern there is because you are traveling. And indirectly, your travel can exacerbate, like I said, already existing health condition. Like she also said, there might be issues in those areas. And when you now travel to a location. And then one other thing I would like to add is that there are, your travel can affect your health. and your health can affect your travel. So a key thing, what is unique about travel insurance also is because your health can also affect your travel. In buying a health insurance, to ensure that your health is protected, they also look at other factors that affects your travel due to your health. So it goes both ways.
Okay.
Something like if you're going to a place where they have terrorism, you find out that your travel health insurance package might cover for terrorism.
Okay.
It can cover for political evacuation. If you're in an area and they start having political unrest, the insurance package might actually be able to cover you for that. It can also, like when we are going to the holidays, people travel with children, So if you're traveling with a child and you get sick, what happens to the children? So they can cover for families to reunite. It can also cover for you to be repatriated back from your home. So it looks at it both ways, from the travel incidences.